Hello, good evening. Thank you for joining us. I'm Krista Sip with Can Do MS. Tonight we're going to focus on making decisions together. Thank you for being with us on this webinar Wednesday, and we are excited to get started. So here we go. I wanted to give you guys a look at April programs. So every month our programs build on one another to help you keep the momentum, develop new skills and habits. So this month, we're going to continue to focus on staying positive. The upcoming Jumpstart and coaching programs both offer a great opportunity to connect with experts, to connect with peers, and to tackle your unique situations and questions that you might have. So please visit our website. These are the topics for this month, and you can register at cando-ms.org. We'll save about 20 minutes at the end of this webinar for questions and answers. If you have questions during the presentation, you can type it in the questions chat box found in your control panel. There's a picture of it here. The presentation is being recorded and will be archived on the Can Do MS website tomorrow. You can download a copy of tonight's presentation and additional resources in the control panel right now if you'd like. And with that, I would like to introduce our speakers this evening. So one of our speakers tonight is going to be Dr. Eliza Ben-Zachariah. She is an assistant professor at Mount Sinai Hospital and Hunter College. She's a nurse practitioner with experience in acute care, neurology, and rehabilitation. Dr. Ben-Zachariah is a multiple sclerosis expert and a researcher. We're very lucky to have her with us tonight. And she's developed multiple neurological educational programs for patients, nurses, physicians, and other healthcare providers. She's on the editorial board of MS Perspective, which is a magazine for people with MS. And then along with Eliza, we also have Dr. Sam Domingo. She's a clinical health psychologist based in Corvallis, Oregon. She is the founder and director of Pacific Wellness Hub, which is a teletherapy service that provides services to individuals living with chronic health conditions and sleep disorders in the state of Oregon. She also is board certified in behavioral sleep medicine and has been working with individuals living with MS and their families for the past 6 years. And with that, I would like to hand the presentation over to our speakers this evening. So ladies, feel free to take it away. Thank you both for being here.
Thank you. Thank you, Krista, for the lovely introduction. I'm really excited to be here with my colleague Eliza talking about making decisions together. So here's our plan for the evening. We're going to talk a little bit about a specific framework or template for making decisions around challenges that we face living with MS, not just health-wise, but in other areas of your life as well. We're going to talk about shared decision-making and gain an understanding of what that is. And then finally, we will cover some general steps for problem solving and how you can apply these to MS.
Thank you both, and good evening, everyone. So let's start. And the beginning of our discussion really start with how you define shared decision making. What does it mean, shared decision making? And this definition is really based on a MS expert steering committee, which mainly was from Europe, but also representation from the US. So again, so what does shared decision make? This is an approach where a team, you, your partner, support partner, friend, anyone in your circle, and the MS team that really share and have the knowledge to share the best available evidence in order to really achieve informed preferences. And that means that you are well informed about your other decision related to your care, which we'll talk a lot during our discussion tonight.
So I really like this slide because I think it really puts it into perspective what we mean by shared decision making. I'm a very visual person, so this actually helps me out a lot to put it into context. So if you look at the center there, you and if you have a support team or family are at the center of shared decision making. So the decision is not based on necessarily just what other people are telling you, but really focuses on your own individual needs, values, etc. And then you have your core healthcare team, which might involve your neurologist, MS nurse. And then those are the people that are there kind of throughout the lifespan that you kind of always rely on. And then the team on the green are your extended healthcare team. So these are people that you might need at some point or at some points during your life for specific problems. So you may have your psychiatrist or psychologist, speech language pathologist, physical therapist. So people that you may not necessarily need all the time to help manage your overall wellness, but just people that you might need at some point. So this kind of exemplifies what we're going to be covering tonight.
And now diving a little more deeper into the shared decision making, what are the components that we need to really have an effective and optimal shared decision making? So knowledge, 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 and most so evidence-based knowledge based on good resources, like, for example, the National MS Society can do MS information. But more importantly than having just the knowledge, you want to think that you need to use the knowledge. You and your support partner, as Dr. Domingo showed, you're at the center of the whole team. You are and always are active participating in the circle, in that center, really making decisions related to healthcare, to wellness, to any needs that you have. And I think what's really important that it goes along and it's aligned with your personal opinions, personal views, values, and preferences. And always important to really reflect back and think, is this what I really want? And based on that knowledge, you make decisions along the way.
And I think one of the aspects of shared decision making that's really helpful to know is that there's a lot of information, right, being thrown at us all the time. And especially living with MS, there's several points throughout the lifespan that you will have to make difficult decisions. And so where do you start? This doesn't just relate to healthcare and managing symptoms, but rather all aspects of your life. So we really like to look at the whole picture of you, including social, personal, financial planning. These are all the specific areas of wellness. And that can include spirituality, cognitive health, work and home. So we'll talk a little bit more as we go through this presentation, what that might look like for these specific areas.
So going into the benefit of shared solution, shared decision making, why we talk so much about shared decision making. It's almost the buzzword around in MS centers and clinical practice. I hear it so often, and the benefit really include, number one, that you make more informed decisions. You have the knowledge. However, it's with guidance of your healthcare team. So you're not alone making that decision. You do it along with your partner if you have a partner, but with the MS team, the nurse, the physicians, anyone in your really team. Definitely the process, because you engage in partnership and have more knowledge, you have better understanding of your options. What are the options that you have? And we'll talk about disease-modifying agents and symptomatic care. But what are the options that you have? What are your preferences? What are your values? And what are your goals? For example, Nanda, and really she showed that what the team wants, she really asked the providers what they wanted and what patient wanted and ranked as the highest priority were different. So for example, providers really mentioned that the main thing was to prevent disability, was to avoid medicine that have fatal side effects and maintain or improve memory. For them, it was more the focus on cognition. So there is sometimes differences between ourselves, the clinician, and patients and the partners. So, but it's important to feel included, be included in that decision-making process. And definitely the outcomes are most of the time are better, and you see much more of optimal outcomes when you have a shared decision making. Going more specifically into disease-modifying agents, so you're not expected to master all the information and the research about disease-modifying therapies. I think it's something that we need to educate through as clinician, myself as a nurse practitioner, the physician, physician assistant, social worker, psychologist. I think whoever is on your team, I think we have the expertise, we know the studies, but you need to have some basic understanding of the disease-modifying therapy. What are the available treatment? Do you prefer oral medication versus the intravenous or perhaps injection because they're safer? You need to know what you're comfortable with. Do I want to be aggressive? Do I not? And you need to do a lot of self-education, really go online. I do it myself when I am a patient. You need to educate yourself about what's out there and what is the research, what is the best evidence, because you want to consider the best treatment for your own disease. And that's the goal that I have as a clinician and many of my team members. So I think this is important. However, you as a partner make the decision with us. It's not that you're by yourself making that decision, but we need to know you better. We need to make sure that we understand what's your goal and preferences for disease-modifying therapy. And the same goes for symptomatic management. When you think about symptoms in MS, and you may come to me and say, that your main problem is fatigue, for example, and you need to treat that fatigue. But I think as a clinician, I would like to guide you and really inform you about what perhaps would be the priority. So, for example, if you are at risk for falls, then perhaps I will talk to you. Maybe the first thing to do is to go for physical therapy. If you have a bladder issue symptomatically, that's really important as well. So perhaps I will tell you, let's tackle this first. So I think the important thing is to really think about your symptoms and how you can really share decision with the team, and how you think about individualizing the care for me to understand your needs and really to discuss different potential treatments. Some symptoms you would want to perhaps treat only conservatively. You wouldn't want extra medication to take, and then the whole issue of polypharmacy. So it's important to focus on non-pharmacological agents, if that's what your preference is, if that's something that we can consider when we discuss it. Many times patients have hesitance to really use the cane and the walker because it doesn't look good. But I think what's really important is to talk about it and talk about safety versus vanity and think about the pros and the cons. I have one patient that after using a cane, it took a long time until she agreed to take a cane, and she thanked me afterwards. She said, "Wow, that was the greatest idea of all." But I think change sometimes is difficult, but my goal is always to make sure the patients are safe. So I think the main key message here that I can share with you is to really manage your symptoms, to improve your care, to improve your quality of life, to promote function. But think about to work as a team and really prioritize the symptoms management and what should be first and what should be second.
Yeah, so some other areas where shared decision making might come up are when it comes to managing your emotional and so, for instance, you may be struggling with stress or anxiety or depression related to your MS. And so discussing with your support partner, your care team about some of your experiences might give you a start as to gathering a lot of this evidence that Elisa was talking about. What are the effective treatments for anxiety or depression in MS? And so maybe a discussion around Whether you start psychotherapy or perhaps include medication management as part of your treatment plan might come up. Perhaps incorporating things like exercise into your wellness routine, making that decision. Or referrals to mental health professionals, deciding if you would like to start with group treatment or individual therapy, or perhaps a combination of both. These are all areas of wellness where shared decision making can be really impactful, because it's not just based on, you know, just what you think you need, but you also get the information from professionals as well as the support of family members and support partners or friends. It really helps with finding a balance with opinions and recommendations when making decisions. So you're not just going by what you're reading on the internet or what information is out there, but it really helps tailor the information down to a place where it applies to you, your lifestyle, your values, and goals. Other areas for potential decision making involve things like family planning, for example, thinking about pregnancy while living with MS. Financial decisions, such as should I leave my full-time job to work part-time to, you know, cope with some of my symptoms. Disability benefits, disclosure decisions. Should I tell, you know, this new person I'm dating or my employer that I have MS? How do you go about making those big decisions? And I think that's really where it comes down to, is that you're really not alone in this, that you have your care team, and we can brainstorm other ways of building that, that team. So speaking of team, at Can Do, we talk a lot about support partners, and I think that's one of the things that makes us unique, is that we include support partners as part of everything that we do. It's helpful to have someone when you're diagnosed, or even as you're going through relapses or there are changes in your disease course, to have someone there. And that doesn't necessarily mean a spouse or a romantic partner, but it could be a friend or a neighbor or a coworker or somebody that you trust, that can not necessarily make decisions for you, but be there for you and be that person that you can bounce ideas off of. That team also includes, of course, your healthcare professionals, as I mentioned earlier, other specialists, social work or psychologists or therapists. Knowing that these wellness challenges that we go through do require that collaborative work between you, your support partner, and the healthcare team. And that involves trial and error. So you may try one oral medication that perhaps didn't work for you. And so you have to think about, okay, what are my other options? And where do I go find that information? And so we really believe that collaboration between you and your team, healthy communication and coordination are all important qualities to shared decision making.
So there are a few barriers to shared decision making, and Dr. Domingo already talked about depression and anxiety that may be a barrier if you don't feel like doing any shared decision making, and sometimes really staying at home. Also, lack of support can play a role in really not being so up to be a partner in the care because you're missing that supportive network. Although we'll talk about some ways to overcome this, and different in expectations. One of the issue that we face a lot is time commitment for the follow-up visit. And I think, for example, one of the things that we have done in my institution was to create another meeting, another follow-up appointment, either via telehealth or face-to-face, to discuss disease-modifying agents. So you don't really clump everything in one visit. You can really be creative and really have another visit to discuss certain issue. Many centers that I know for example, have symptoms clinics. So, for example, if you have one symptoms like bowel issues that you'd like to discuss, and will take about an hour because you speak about diet, you speak about the routine, about movement, and many other part of it. And I think that allows you to focus on one symptoms and spend a lot of time with the clinician. But we'll talk more about waste and strategy in a minute. Other barriers that can play an issue when you try to have shared decision making, any cultural differences or barrier, language issue. If you don't speak the English language and you speak mainly your primary language is Spanish or any other languages, lack of knowledge, you're missing that important information and really reliable information about your care, about wellness choices, about DMT choices or symptomatic management. And lastly, cognitive challenges. It's definitely highly prevalent to have cognitive issues in MS and other neuroinflammatory diseases. So any issues about memory can affect it a bit, lack of understanding about DMS disease as a whole, and really lacking of attention and concentration ability that really allows you to store all the new information that you've learned, and will be important to really address this these barriers. So a few strategies that we can share, and Dr. Domingo will speak later on as well, really to try to get support, really know your resources around you, make yourself familiar with all the resources. It will require some effort, but the National MS Society, Can Do MS, many other organizations, MS foundations, have either individual supports that you need to seek on your own, either privately or through other means, and support groups. They're very helpful. We have a weekly support group at our institution. It's very helpful. People come in to network. Perhaps sometimes you don't want to listen, so you can come sporadically. People are different, so you need to really know yourself and know what you prefer, either individual versus group support. Not everything is for everyone, but it's something that's fluid. You have to really assess yourself. I like the other notions that both Dr. Domingo and I spoke about, that you really need to find the right healthcare professional in the center for you. So it may be the social worker. You have to have some connection to one of the team members. Some of you may have connection with the nurse. Some of you may have connection with the physician, psychologist. Really identify that person that really had that connections, and you see things eye to eye or eye by eye. It's really important to identify that, because that person can advocate for you, can be supportive in a way whenever you are calling the center or coming to the center. Different communication strategies are very, very important, especially using translation services. Very often, I don't recommend the family to translate for the patient. Sometimes family can translate it differently because they want to protect the patients. All the time in my practice and in my institution, it was Mount Sinai Hospital in New York City, I always use the translation system of the hospital. I prefer to have someone foreign. I know I can trust them. They have no issues. It's important that someone knows that, yes, family is good. It's right there and they can translate and help you. But very often I found that sometimes family wants to protect you, so they will choose the word to use. So important as well. I talked about individual and group support, so seek emotional support. Again, I think resources are so important, but if you don't reach to these resources and identify them and look around and Google and call certain, you won't really be familiar with all those resources. So again, as I mentioned, it requires some work, but it's worth it. It's really important to identify who are around you and what are the community resources that you can use and can help you. And definitely, if you have any cognitive issue, and as I mentioned, it's highly prevalent in MS, make sure you have a baseline evaluation. Most centers now, MS centers, I highly recommend be a part of an MS center rather than a neurology practice, but sometimes your area, your geographical area does not allow it. But just make sure that you have an annual cognitive testing. Definitely weekly baseline cognitive evaluation, and then annually or biannually if that's required. So it's really dependent on your need, because once you do the evaluation, you can follow it up over the years, and you can use some remediation plans, some compensatory mechanism that can help you strategize your day, do things in the morning if that works for you and your memory and your energy is much better. So I think that many of these things, as Dr. Domingo mentioned earlier, is trial and error. You have to always evaluate what works for you. We can suggest as clinician, we can work with you, we can do the shared decision making, but there is a lot of trial error in everything I've done in neurology and related to MS, about symptoms management, about the DMT sometimes, because you have to really take this either non-pharmacological or pharmacological strategy and see if it works for you. So there are modest effective strategy for cognitive remediation, but there are few in rehabilitations. But there are things that we can use to compensate, and hopefully in the future we'll have even much more effective strategy to really manage depression, mood, emotional issues, and cognitive issues.
So much around decision making involves solving problems, and that can be difficult because where do you start, right? Like, how do you go about solving problems? And I mean, we all solve problems every day. I mean, we're humans living in life, and we all have to deal with this in some shape or form. But when it comes to making big decisions around managing your wellness, managing life with MS, we find that having some strategies or some sense of a template for how to go about solving problems can really be helpful. So we're going to walk through some of these steps, and we're going to use an example as we go through. But one of the first things that we can do before we even start to problem solve is just to define the problem. So what specifically is a problem? Is this more of a problem that I'm imagining might happen? So is this more related to maybe a worry about the future or what might happen, but not an actual problem that's here right now? Basically, what's fact versus opinion or what I'm imagining. Then generating some potential solutions. So that includes evaluating your resources, like what are the resources available to me? What are some of the things I can do? What are my options? And then actually implementing the decision. But as we've been mentioning, a lot of it is trial and error. And so sometimes that solution may not end up working out for you. And so you have to step back and kind of start over. And as you go along, you evaluate the outcomes. So a little more detail, and kind of let's put it into real life. One example might be, and I'll read this out loud, I have not disclosed my MS to my employer of 5 years since I have not needed accommodations. I am now experiencing significant fatigue that is starting to impact my work. I am conflicted about disclosing my diagnosis. So now let's try finding a solution using the steps that I just outlined. So first, we want to define our problem. So the problem that this person is having is, I'm having trouble deciding if I should disclose my MS diagnosis to my employer. So basically, some ambivalence around this decision, this choice of disclosure or not disclosure. They have a friend who was fired from their job after he made a request to have a reduced schedule. So there's that fear component of this. This is something that might happen. It's not necessarily a problem for you right now because we don't know if that's going to be the case for you. But it's a true fear and a valid fear. And so that the problem is the decision around disclosure or not. So our next step would be to generate and evaluate alternative solutions. So first, we want to brainstorm. We don't want to evaluate just yet. We don't want to shut down ideas before they even come to the surface. So potentially, you might want to discuss with your support partner or friend or coworker how to go about making the decisions. And this is kind of like a big brainstorming session. There are no right or wrong answers. You're just kind of outlining what comes to mind. You may also want to focus on short-term and long-term goals. So for example, in the short term, while you figure out how to manage your fatigue in the big picture long-term, you may want to think about potentially taking more frequent breaks at work or seeing if that's a possibility. And then in the long term, you may potentially want to look into reduced hours or maybe having a more flexible schedule. Another step might involve looking at your options and resources that you have available. So we mentioned the National MS Society has a wealth of information and support that is available to everyone living with MS and their families. You may want to talk to the Human Resource Department to find out what the steps are to make such a request. You may want to consult with an attorney if that's available to you, if that's possible for you, to identify ways to kind of protect yourself. And that's more related to that fear of getting fired that we talked about. So you're kind of preemptively thinking ahead. Then you want to look at the pros and cons or risk versus benefit. So basically bring a sheet of paper, or if you're like me, you may have a whiteboard at home where you can just list out all of these options and look at what are the pros of that option and what are the cons of that. And that visually helps you organize your ideas a little bit more specifically, especially when it comes to big decisions like these. Asking for support when needed. So for example, checking in if you have a social worker that's available to you, if you have a therapist, or someone that may offer some of that silent support, not necessarily involved in making that decision for yourself, but maybe offering a place to bounce ideas off of. And then keeping in mind that your decision ultimately is your decision, and it should be based on knowledge around what's available to me, facts, your own values, your goals, and then cost versus benefit ratio. So keeping all of these things in mind. And then here's the fun part. We just do it, right? We implement and we take a look at what happens. So how will you know if the alternative works? So maybe it turns out that your employer said that it was good, it was fine to go ahead and take breaks or have a more flexible schedule. They might come back and say that that's not possible, but that you can work with human resources. So what happens when your decision doesn't generate that desired outcome? Well, this is time to come up with your plan B. And I know the theme of the month is to stay positive, and so definitely staying optimistic, knowing that just because you made a decision and it didn't turn out the way you wanted to, that's the end all be all, that there are always more options. And in this case, it might be, well, are there any other options maybe within the same company for a different position that would allow me some of that flexibility? So really taking stock of the big picture and how it aligns with your preferences.
So following all this, we're going to really conclude with all the important communication tips for talking and listening that all part of the whole discussion and shared decision process. So a few strategy for really effective communication. So I think you probably heard it many times from people writing down your questions, or either sending questions before your appointment if it's possible, if you have a way to really send them. I know I don't really write questions. Sometimes I get flustered and you forget what you really wanted to ask, and then you get home and said, oops, I didn't ask that question. It was so important. But it's always important to think and plan ahead. It's just much easier when you have your list of things to do and a list of questions to ask, and always ask for handouts or reading information. Many of the MS centers have some reading information about different symptoms, about DMT, about different related component of the shared decision making or your care of your MS. So important to always ask for any reading information if available, and try to bring your partner, your friend, friend, your neighbors, as mentioned earlier, if you have supportive partners, whoever is there that you think will really come along and provide support and really advocate for you. Sometimes you won't have that and you go on your own, but however, the MS team become your support system. So I think there's always solution, and it's depend really on your outlook, as mentioned, really to try to be optimistic, think about it. Okay, if I am the one that's making the decision, and anyhow, family don't really make decision for you. They are there to support you, and then they give you some advice, although families are sometimes different, but you are really the one that making the decision in the end. So a few tips to go along with this about listening and talking. And definitely every good conversation starts with listening. So let's talk about listening first. You really need to listen actively and sometimes confirm what you've heard. It's the teach back methods. You always want to sometimes summarize. People have different ideas how to do that. So sometimes you can summarize, or just you can say, I think you heard, I heard that you mentioned blah, blah, blah. So I think it's important sometimes to do this, brief summaries, and really make sure that you understand and listen really carefully. Pay attention to your own body language. It's on both sides, clinician and patients and family. Sometimes we use them, and it's definitely most of the time inappropriate. So, but pay attention. I always try to make sure that I pay attention to my own body language. I use a lot my hands and everything. I think, it's probably being Italian or Jewish. So either one, correct? So, but try to really think about it. Try not to interrupt conversation. Listen. However, if there is something very important in the middle of conversation that you can say, excuse me, I didn't understand that. So nothing is static. Everything is dynamic. It's a conversation. It's communication. Although these are some tips, but there is sometimes things that you are not familiar with, and the conversation can go on, and it will bother you. So it's okay to do it gently and say, excuse me, I didn't understand this. Sometimes we use medical jargon that are not really clear, and try not to jump into conclusions if you're not sure about something, and you ask the questions. I mean, we always assume and come to conclusion. We'll all do the same mistake, but it's important to really stop and say, okay, let me ask the questions. And lastly, a few tips for talking, really. What are the do's, really? So make the time for talking, really, even arrange for appointment, or make the time even with family. Sometimes days goes by and I feel I didn't have a meaningful meeting or appointment with my husband because everyone is busy. But you need to sometimes make the time for talking and just sit down and relax and just chat about the day. So you want to do that with family. You want to do it with the MS team. Definitely, we all are different. I can tell you, first of all, that no two patients have the same MS. In all my practice, more than 20 years at the MS Center at Sinai. So I think it's important to understand that we are different as people. Our communication styles are different, our culture is different, gestures may be different, but it's always important, if you don't understand something or we think patient or clinician said something that really wasn't right, come and communicate. I think it's important to empower yourself, and I like the use I statement. It's I am deciding, or I am doing this. I would like you to guide me. I would like you to educate me about these options that I have in front of me, because you want to make that decision really to the best decision ever for yourself, for your goals and values and preferences, and give the other person always a time to think and respond. I think sometimes we talk, both clinician and patient, or patients and partners and friends, whoever it is. So sometimes we have to step down and really be quiet for a minute and then respond and think about what we want to say. Try the few don'ts here. I think overgeneralizing is sometimes it's not so healthy. We do this often, but try to do it less if possible. I think sarcasm is never good in conversation and communication. I just put the other side hope, unless it's someone that you know. If it's my kids, I'm allowed to do that. But I think it's important, and it's the same as give the person the time to think and do that. But lastly, sometimes we know what the other person said they're thinking, and there's no really magical thinking here. I mean, perhaps you have some intuition, but no one can really read your mind. So always talk and ask the questions. So I think these tips are really helpful for everyday life, and not only for shared decision making, but any discussions that's out there. So, and I'm going to conclude at this. Thank you so much for listening to both Dr. Domingo and I, and we are open for questions right now. Thank you, Krista.
Awesome. Thank you both so much for giving us the breakdown of what making decisions together can look like. So we've had a number of questions come through, and I'm sure, anyone who is listening, please continue to pop those in the questions chat box there. But one that I want to start out with is, we're talking about making decisions together tonight, but not everyone has a support partner or has someone who is with them. So what suggestions do you have for someone who is making decisions, mostly on their own?
Yeah, that's a really great question. And I think that it's a reality for many, many people that not everyone has access to that one support partner that's there reliably throughout every appointment, every decision, every event. And so I think getting creative to build your own version of what support might look like. So that may mean that you include, not just your healthcare providers, but maybe include a neighbor or somebody from your church if you attend a church. It might be that you have a friend who lives on the other side of the country, and now with COVID, I think we've all been used to having frequent meetings over Zoom and phone. And so maybe bringing them to the appointment. This actually happened a lot at the last clinic where I worked, is people would come in with their cell phones and show up with, to their primary care appointments with somebody who lived across the country, just to have somebody else's presence there. If that's not accessible to you, I know that the National MS Society and many, many other organizations offer support resources, such as the MS Navigators at the National MS Society, support groups that are held locally and right now are being held online. So you don't even have to leave your home to build some of those connections. And that may give you kind of a way to start building that support team, that support system. That may not be one person reliably all the time, but maybe you get to choose, or depending on people's availability. But really, creativity, thinking outside the box, and applying some of the techniques that we talked about today when making big decisions. I don't know if you have anything else to add, Eliza. That was kind of what I was thinking.
I think that you mentioned the important things, and I think I talked about really reaching out and finding those support systems and resources that the National MS Society have, or any other organizations. And I think at some point, if you don't really have someone to come with you, I think you can find that support in the MS centers and really talk to the teams there. And often people connect with the nurse or physician assistants or nurse practitioners, and they become part of your network. We've done some groups at our MS centers, and many patients mentioned that their aide became their support system. So it can be anyone, as mentioned, and I think that what's really, really important to realize. And yeah, not everyone has a huge network of support, but sometimes you just have to identify and be aware and know what to do next. And I agree, be creative. Think about the resources and supportive networks that are out there that may provide you some support.
definitely thinking outside the box and being more intentional. I think a lot of us think of support partner and we think, romantic partner or spouse, and that's not the case for a lot of people. So thinking of what that might look like for you, and what you need from them is important.
Awesome, thank you. The next question that I saw come through is, what tips do you have for someone who struggles with managing memory and processing skills when discussing and making decisions?
So I think that the first thing to really be aware of it, and I think once you mentioned the question, you're probably aware of it. I think that's really the first steps, to be aware that something, because many patients don't feel comfortable discussing it. It's one of the invisible symptoms. So if you don't discuss it, we don't really know about it. So I think the first steps is really to open up and tell your team, MS team, all the MS team, that you feel that you're struggling with memory, that you have some perhaps subtle questions, cognitive issues, and your ability to perhaps be involved in shared decision might be a little off. But I think that the next step is to do a really good, thorough cognitive assessment. And once you identify that you have issues, you want to have that test. You want to speak with a neuropsychologist if available in the center you're going to, or you can be referred. Nowadays, there are many more neuropsychologists, experts in MS, specialized in MS, that you really can find. Not always through insurance, so it's important to really get in touch again with National MS Society and other organizations that have often a list of neuropsychologists, but often your center can refer you. So once you meet a neuropsychologist, have a thorough either a neuropsych battery or either short tools like the symbol digit modality test or any other test. The PST is available via online. It's the same as the SDMT that I just mentioned. These are very short tools that can really test your cognitive function. So again, first step, awareness. Second step, talk to your team about this. Number 3 is really do the cognitive assessment. And then hopefully there are some remediation that can help you really be involved in shared decision making. There's some ways that you can use compensatory mechanism that I mentioned earlier. There's some of the neuropsychologists really do games with patients to really increase and really work on their memory. There are post-it and really list of things that you can write down rather than memorize them because you have some issue with memory. We all use post-it. I put 10,000 things about my appointments. I mean, we all do that. I can tell you, and I'm really embarrassed to say, but I will share it with you. I had 10,000 post-its for my mammogram that had to be one day, and I forgot my mammogram. I forgot to go because I was busy with patients. So it just, but we all do that. But I think it's the important piece is really to use any mechanism that you have to help you. Don't be shy. Don't be embarrassed. Cognitive memory issue happen in MS. We don't really see judgment issue. We see more of a memory and attention, decreased attention and concentration. And especially if you have other symptoms, for example, fatigue can really make your memory issue much worse. So you want to take care of the other things that can really influence your awareness and making decision and memory. So fatigue can be one, lack of sleep can be another one, medication side effects. We sometimes take too many meds, so those can really affect your memory and make you more on the low side and less concentrated. So there are so many things that you can do really and on your own self. So really, it's so important to be empowered and as Sam just mentioned, think outside of the box and use all the strategy that you can to really manage this memory issue, because you want to be involved in the shared decision making. And if certain time is better for you to make this follow-up appointment because you're going to talk about medications for your MS, so arrange for that appointment at the time that you are at your best, that your memory is good, that you have that list, that you have everything in place. So I think, again, be creative and think about all the way that can make you at your best. I don't know if you have anything to add.
Yeah, I agree with everything you just said. I think cognitive functioning is so tricky because there are a lot of factors that can influence cognitive functioning. Like you mentioned, sleep and fatigue and other symptoms of MS, depression can also bring cognitive challenges. So I think having a plan for what to do in your day-to-day, like what are the things that you're struggling with specifically? Is it remembering appointments? Is it remembering to take your medications? Is it that you're having trouble processing what's being said in your appointments? And so depending on what specifically the issue is, there are a lot of strategies that can help you manage, like staying organized, having a planner, having a whiteboard or something like that in your home that you can kind of post all of your Post-it notes on and you can remember to look at. There are a lot of ways, I think, to go about some of these challenges. And I think that it's, the important thing is that MS can bring up some of these challenges that Eliza mentioned with short-term memory, attention, concentration, processing speed, and all of these things. But I don't think it's common for it to take away your ability to make decisions. So, and that's really one thing that's really important to keep in mind. That I know that there's a lot of fear around what if I forget, or what if I can't make decisions on my own anymore. And that may happen, and for some people, but I think that's not what we see more commonly in MS. Oh, and there's a webinar, right, coming up on cognitive challenges next month?
Yeah, next month is on mood and cognition. That it has on, the MS has on mood and cognition. So good call out in memory there, Sam.
Great point.
And then, I did just see one person chimed in that her neurologist team puts more information on her after visit notes in the reports to help her, remember what's going on. So maybe talking to your physicians about being able to do that could be a great option too for some folks.
Yeah, that's a great point, Krista, because nowadays we give patients the discharge summary. So, and I had some in the past, some comments to it. So yeah, it comes generated from the computer. Great idea.
Yeah. Now, what about making decisions? How do you stick with them? So if you're making a decision maybe about a goal or, something that you want to implement in your life, how do you stick with that decision?
That's a good question.
It's a challenge, but I think that it's definitely decision making is a dynamic process, and it's not something that's static really. And you want to be able to change your decision at some point if you really gain new knowledge, for example, and you discuss it with your team, the MS team, or either with your family, and you really saw some evidence-based data about something related to your care. I think it's okay to really change your decisions at that point, because you really got some new information that can really contribute to your decision, and maybe the decision that you wanted to make before was not the right one. So I think every case is an individual case. So there are often sometimes that if you want to really keep the decision and it's an important decision, you just have to really get some resources, get some support as much as possible, the same as we talked earlier, and really think how you can get that support for the decision to really go through if something that you really wanted to be accomplished. But I've seen so many patients, including myself, that have made a decision and made some changes because of some new data that was evolving and added to their information. So I'm not sure that always is the goal to stick with one decision. Sometimes it's okay to change, but sometimes you need to really stay with a decision if it's something that, for example, if you decided upon a medication and you really have to continue to take it, and you made that decision and you already got the medication and started, so you want to really be adherent and make sure you go along with that decision. So I would say again, I think it's individualized and it relates to what type of decision you really are making. Dr. Domingo, anything else?
Yeah, I think if it's a decision around, for example, a change in lifestyle, like if you're starting to a new exercise program or, some sort of new habit that you're building, I think focusing on goal setting and SMART goals, which I know we've talked about in previous webinars and programs, can be really helpful. It also helps you evaluate whether something is working for you or not. And I think staying with that flexibility that Eliza is mentioning is another way to kind of manage the stress that comes with making big decisions. If you're too rigid, that's going to create a lot more stress for you, and that's probably not a good thing. So knowing when to try something new, try more options. Again, it's that whole good old trial and error, and it depends favorite psychologist answer. Really unique. Yeah.
Trial and error, yep. So I think we have time for one, maybe two more questions. We'll see. One for sure. So how can I handle decisions regarding change in a better, more positive way? I liked this question because the theme of the month is staying positive. So decisions regarding change in a better, more positive way.
Yeah. So this kind of goes back to that idea of resilience, right? Which is our ability to bounce back from adversity. And so finding ways to build that resiliency, I think, can help you or anyone really, any of us, stay positive. It's not possible to be positive all the time. There are going to be times when you're going to feel frustrated about the outcome of a decision. And then you feel your feelings. Like I tell my clients, let yourself feel it out and then move on and think about what else can be done and what are my options. Because the reality is that life is, not always going to turn out the way we expected, and there are always going to be things that don't work out for us. So I think looking into building resilience, which I think also shameless plug, we had another one last month on that, I think is part of our webinar series. That can help you stay positive in the face of adversity, which I think we've all been tested this year.
I agree. I think sometimes we are so resistant to change because we always think change is probably not a good thing. So I think just to be open that some changes can be really positive and really something that you can look upon and say, wow, it really generated a good outcome. But sometimes it won't. So I agree with Sam. I think you just have to build up your resilience and really empower yourself to make decisions. And again, really sometimes expect the unexpected, and sometimes it just we're going back to the trial and error again. But I think it's all about, that's what life is all about, correct? We make decisions and we look at the outcomes, and sometimes they're really great outcomes and you say, wow, but sometimes it's less of a great outcome. So you need to rethink that and just be supportive of each other's and really try to stay positive.
Yeah, keep in mind all the decisions that you had to make up to this point and how they turned out. And I would bet that there have been a lot of successful changes that have happened in your life. So change is scary and also inevitable.
Yeah. Mm-hmm.
No question. Well, I want to thank both of our speakers tonight, Dr. Eliza Ben-Zachariah and Dr. Samantha Domingo. Thank you both so much for being here. Thank you for that informative presentation, and also thank you for answering these questions during the Q&A session. I did want to ask all of our participants, as a reminder, we will ask you to complete a survey at the end of the program here in a couple of minutes. It'll pop up on your screen at the conclusion of the webinar. And of course, we want to stay connected with you. This webinar may be over tonight, but we hope that you will take this opportunity to connect with us further. Follow us on social media for the latest programs, resources in MS News. You can also register for our monthly e-news series by visiting our website, cando-ms.org. Additionally, the mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. You can explore other society programs and services, resources, and connection opportunities at nationalmssociety.org. And as Sam mentioned, please remember to tune in next month to our webinar Wednesday on May 5th. We're going to be focusing on how MS impacts your mood and cognition. So that is always a hot topic, and we hope that we'll see you next month. Thank you so much for everyone who tuned in tonight, and thank you also to our sponsors for making this program possible.